Now we're going to see the class 1B antiarrhythmic medications. The class 1B blocks the sodium channels in the inactivated state. Remember that class 1B will be for hypoxic tissue. Hypoxic tissue is a tissue in which there is no ATP because there is no oxygen, and so we cannot produce ATP in the oxidative phosphorylation. So there is decreased ATP. If there is decreased ATP, there is decrease in the action of the sodium potassium pump. If there is decrease in the sodium potassium pump, the sodium is inside the cell, and sodium inside the cells depolarizes the cell. So ischemic tissue, hypoxic tissue, is a depolarized tissue. So in the inactivated state of the potassium of the sodium channels is when the tissue is in a depolarized form. Now the hypoxic tissue spends more time being in the sodium inactivated state of the channel due to decrease in the sodium potassium pump because there is decreased ATP. Alright, now the class 1B, there are drugs that selectively binds to the sodium channel in this inactivated state. So these are mexiletine, lidocaine, and sometimes phenytoin also can go in this category. Lidocaine is the less severe, less adverse effects of the antiarrhythmic, but you know that when we give lidocaine for anesthesia, we certainly have the concern of some arrhythmia in the heart, and so what we mean with less adverse effect or less antiarrhythmic, less arrhythmogenic, that is because the others have also potent effects. Alright, so lidocaine will be given in IV form due to first pass metabolism in the liver, so we will give it IV. Mexiletine, there are oral formulations. These drugs will be used after ischemic heart, usually post MI, because there will be ischemic tissue, and this ischemic tissue that we want to prevent to have a arrhythmia, and so these medications binds to the inactivated sodium channels and decreases the action potential duration. So we have, this is the action potential of the heart, of the myocyte. There is a decrease in the upstroke of the zero phase, so it would look something like this, and the duration of the action potential is reduced. Even though there is a little bit of blockage of the potassium channels that would lead to increase in QT, but no, overall there is decrease in the action potential duration, and so for that there is no QT prolongation. We would not see that. And the treatment for the ischemic disease, hypoxic tissue, post MI, in order to prevent a arrhythmia or to decrease the arrhythmia, would be with the class 1B, that could be mexiletine or lidocaine. Also, after surgery, open heart surgery, we can give these medications, and for other kinds of ischemic heart disease in order to prevent some arrhythmia. The adverse effect could be sometimes CNAS effects like convulsions, seizures, etc. And in the next video, we're going to compare this with the other two classes, the class 1A and class 1C.